Morning, Nicole.
Good morning. I am at the Dismas, so this is my first time using their Wi-Fi and having my computer, so it's been a little hectic, but
Okay.
I made it.
Supposed to have a speaker this morning.
Oh, do you know who it is?
Yeah, I'm trying to figure it out. I'm trying to find her name on. Uh, here we go.
I am so sorry to jump in really quickly here. I am in person in the workforce development room. Has that changed that we are having any in person today?
Uh, if for someone presenting.
No, I just saw in the email that we were switching locations to this room. So I am here, but nobody else is. So I
Okay.
assume
Now
it's all
that,
Zoom today.
yeah, well, it's Zoom. I think it's virtual. I'm not sure because Dominique takes care of that area
Okay.
because I'm in Logan.
Okay.
And so I think that email that she had me send out was, uh, I guess that they were supposed to start using that this week or this month or
Okay.
something.
Okay.
Something about they got a new location.
Yes. I came to the new location just to see it. And my paralegal and I were the only ones here, and that is fine. I work in
Right.
Parkersburg, so we are not uh, put out in any way. But I just wanted to check and see if we were just doing virtual today.
Well, yeah, you could, I'm here. I'm running the meeting.
Perfect.
Dominique is not going to be here today for I'm
Okay.
not sure what, but I'm the one
Okay.
going to take care of everything.
Well, I appreciate that. We'll be here
You're welcome.
virtual. Thank you.
You're welcome, ma'am.
Hey, Kaylee, this is Rich. I did see that email as well. I forgot what it said though, but there should be folks in person somewhere. It's kind of odd.
Yeah, they said they were gonna be the 6th floor.
Six foot right. Yeah, yeah. Are
It's
you
a
on the?
beautiful room. We're here. They let us in.
That's that's strange.
Uh, but
That's okay.
usually I actually used to work I've only been in this position a month, and that's where I come from. Usually, they have that, big smart board thing that they turn on and do the Zoom from that.
And usually this meeting is well attended, so I'm really surprised. I'm imagining there's people in another room somewhere. I don't know what the confusion would be, but typically this is a well attended council.
Yeah, it is. And I see that our speaker is here as well, but I'm going to try to uh, give it a few minutes for see if everybody can get. Maybe there's people somewhere else in that building and it's not here yet.
Or maybe they didn't get that email or something. I don't know.
I'm wondering, so I attempted to get on a Teams meeting because Dominique had invited me to a Teams meeting, and then I went back to my emails and realized there was a Zoom link. So it's possible people are on Teams?
No, because this meeting is held monthly on Zoom.
Oh, so that was just me. I'm gonna leave and come back because my camera is not turning on. So I'm gonna try
Okay.
that. Well,
All
since
right.
we're waiting anyway.
Okay.
Still no video.
Still no video, Rachel?
No, I'm gonna try logging in from my phone and see if that works. It's always harder to get a phone set up to do video, but I guess you don't have to see my face. We have had all sorts of tech issues in the last 24 hours, and I don't know if it was related to the national outage yesterday or not, but I couldn't log into any of my systems this morning. So we're trying.
We understand.
Government work, am I right?
Oh, no, I'm nonprofit, so.
Yeah. Well, technically, we're owned by a mega corporation, so you think we'd get it, but they don't give money to Medicaid. All right, let's see if we can get it.
Recording in progress.
Oops, sorry. Can you see me?
I see you now.
All right.
Okay, so we've been on here about 6 minutes, so everybody should have been here already. So guys, Dominique is not going to be able to be here this morning, so she asked me to run the Reentry Council for her. We have a presenter today, a Miss Rachel Dickel from Health Promotion Consultant with WellPoint. Is that correct?
Yep.
And so she is going to be presenting today. So Rachel, the floor is yours, and then maybe after we'll have questions and answers session.
Okay. All right. Well, I'll get started. I work for WellPoint. We're one of the Medicaid options in West Virginia. So anyone up to the age of 65 that needs needs-based healthcare, health insurance, we're one of the options along with Health Plan Aetna and now Highmark. And I'm just here to talk to you guys a little bit about what I do, what my program is, and then because a lot of people ask, I'll go over benefits. I am not the benefits expert, so I'll tell you what I know. And if you have any further questions after that, I can always refer you to someone who knows more than I can. My team is based in social determinants of health. So you all work in reentry. You all know what social determinants are. It's all of those things, that 80% of our health that just doesn't take place in a doctor's office, isn't something that's genetic. It's those things like, do I live in a walkable neighborhood? Do I have transportation? Do I have access to healthy food? Right. So we live in West Virginia, and I know this is the Wood County reentry, correct? Or is it all reentry? MOV. So we're fairly resource rich compared to some of the counties I work in. Some counties I work in, the only grocery spot that someone can get to is a gas station or a Dollar General, which makes it really hard to get fresh fruits and vegetables. So my team works in all of those areas, and we have kind of two parts to our team. One part is our navigators. So we have folks that work specifically with our members. So if a member fills out a survey or a doctor puts in a Z code, and a Z code is something like, I had a doctor's appointment with this patient today, and they mentioned they don't have transportation. When they're billing for the appointment, they can put in something called a Z code that says, hey, this member doesn't have transportation, and it gets sent to us, and we can refer it out to either case management, behavioral health, depending on what the person's needs are, or my department. And our navigators will take that and say, oh, we've got a member who needs transportation assistance. Why don't we call and work with them and see if we can't get them connected to some kind of transportation assistance? And so our navigators will call out to members and say, hey, we saw you have a food need. Let me give you all the resources for local food pantries. Do you have transportation to get to those food pantries, and try to get them connected? So, for example, one of our team members just a couple weeks ago, she had a family that was out of diapers. They needed diapers. It was Friday. It was like 5 p.m. Well, a little bit before 5 p.m. And they needed food and diapers to get through the weekend before they could go into their regular food pantry. So our navigator knew somebody with community markets up in that area, called them and said, hey, we've got an emergency need for this member. They really need this. And they were able to get the community markets guy to go deliver these items to that member to get them through the weekend until the next week. So that's like one of the things that our team does. And for those navigators to be able to do what they do, there's my side of the team. And so we go out into communities just like I'm doing today to talk to you all to find out what resources are there. What are they offering to keep up to date? So for example, we usually refer to community action agencies if someone needs utility assistance. Right now, utility assistance is frozen. So I can communicate that back to our navigators and say, hey, we're gonna have to try a different route, because what we don't want, and I think you guys see this in reentry as well, is someone having to call 27 places and have them all deny them. We're trying to make that shorter, make it fewer amounts of calls so people don't get discouraged. Because I know if I've made 2 or 3 calls and the answer keeps being no, I'm going to stop trying. And I don't have half the barriers that a lot of our members do, but I'll admit it, I'm a quitter. So we're trying to reduce those barriers to health. And so that's one thing we do. My team also does some direct outreach to members, and you all don't see a lot of that. But for example, we'll have, say, Copeland Clinic is saying all doctors' offices have to meet certain metrics with Medicaid, right? They have to have a certain number of their patients getting their well child visits or getting their immunizations or, getting dental visits or things like that. And if they're having trouble meeting those metrics, they can reach out to our team and we can work with the quality and say, hey, let's call some of our members and just remind them. Sometimes you forget, life is busy and you forget that your kids are due for their tetanus vaccinations or something like that. And so we'll do call outs and remind them. Some of the biggest ones I do are mammogram reminders, diabetic retinal eye exam reminders, those kind of things. And we work directly with members. And again, if we're calling someone and they say, well, I don't really have a car to get there, or I've got this bigger issue on my plate right now, then we can refer them and work with them on those things. We're not social workers, but we kind of do little bits and pieces of that. Another program that I work in is our employment services program. So it's similar to like a coaching program, right? I get a member, they said, I'd like to get employment, but I'm having trouble. So I had one member who ran a small business, and she said ever since COVID, the business hasn't been as good, and she wants to get online, but she doesn't know how to get her business online. So I was able to connect her with the Small Business Development Center and get her a coach with that so that she could learn how to transfer her business online and get her back up and running, right? The other thing our employment service program offers is if we have members who need a laptop, or I think it's like 3 months of internet, we can give them a laptop and an internet card to get going. So I ran into a member, I was teaching health education at a spokes class, and the teacher said, well, this person in my class, she always has trouble logging on because she's doing all her class from her phone. And I said, well, if she is a WellPoint member, I can get her in the employment program. She's already doing education for employment. Let's get her a laptop so she can actually participate in class. And we're able to get her that laptop. So if they're doing education that's employment focused, I just sent a laptop to a guy that is enrolled in a nursing program. And he was out of work because he got injured doing home health care. And so this was part of his pivot. He's like, okay, I'm going to do nursing now because I can't lift people anymore. And we're able to get him on the way with his education for that. We also do it just if someone is looking for a job. It's really hard to look for a job from your phone. It's really hard to look for a job. We don't do paper applications anymore. It's all online. And so that is a resource we're able to offer. We don't advertise it widely because, I could put my information in the chat. Yes, sorry. I'm also working from my phone today because tech issues. So I'll type that in there. Or Jonathan, I think you have my email if you're able to type it in. But it's just rachel.dickel@wellpoint.com. And my last name is spelled Dickel. So we don't broadcast the laptop thing because everybody would just call and say, I want my laptop. What we're really trying to do is that for these folks that this is a barrier to them getting employment, we're trying to reduce that barrier. It's a basic laptop, but it does the trick. And I've had at least one member now, a lot of them are doing it for education, but I've had at least one that was like what helped them fill out applications and get their job. And that's an easy fix. The other thing I can do is help refer them. I had one guy that said, well, I'm out of money, but I need new ink for my printer. And I said, well, libraries, if you don't have the money, they'll print for free. and I was able to direct them to his library or a one-stop workforce center. You're able to print your resume for free there. So just connecting them with resources is part of what I do. The other part of what I do, which I think is what caught Dominique's interest, is that I do health education, right? So one of the barriers to health is that we just don't know enough. Doctors have 15 minutes when they're in the room with us. And so someone will say, you've got diabetes, here's your metformin prescription, eat healthier. And that's all this person gets for diabetes. Or, they're like, well, now I've got the sugar. I guess I'm going to be sick the rest of my life. Where I come in is that I have certifications that I can teach certain programs or any topic that the CDC covers. If you're seeing something with the folks you're working with, like I just had someone message me about dental health. They said, we're getting a lot of people, they come out, they have really poor dental care, and they're afraid to go to the dentist because they don't know what's going to happen, or they don't know how dentures work or how implants work, those kind of things. That's something that I can come in and I can help kind of demystify that for folks. I had someone come in, they were teaching a bunch of teenagers in a, I don't know if it's adult ed or like spokes, but I was teaching them and she said, they are not getting enough sleep. Can you come in and talk about the importance and health values of sleep? So I did that. The programs I'm certified in, one is called Diabetes Education Empowerment Program. I don't know how many of your folks experience diabetes, but 50% of the state is at risk of diabetes. So anyone who's at risk of it, you got high blood pressure, you got high cholesterol, you have a family history, you just got your 23andMe results back and it says you got a risk factor, any of those are good candidates for the program. Or if you have a loved one with diabetes, because it impacts so many spheres of our life. And it's an 8-session program. It's 8 one-hour sessions. Different organizations structure that differently depending on the needs of the folks that are there. So sometimes I'll come 8 weeks, 1 hour a week. I've done 4 weeks at 2 hours. It's a lot of information to stuff into people's heads in 2 hours. But it is peer-led and peer-based. So we're all sharing what we know about diabetes. I'll interject with some things that folks might not already know. We cover anatomy, what do all the organs in our body do and how are they impacted by diabetes. We talk about nutrition, and we talk about movement, we talk about medications, we talk about monitoring. For someone who's been in an institution where every hour of your day and every decision's been decided for the last, who knows how long, 1 to 10 years, they're coming out, they're re-entering the world, and now they have to manage all their care themselves. When you're talking about someone that has to stick their finger 5 times a day for diabetes management and manage medications and all that, it can be incredibly overwhelming. So that's one of the things we work through is how do you stay on top of monitoring? How do you stay on top of medications and doctor's visits and things like that? That's part of the program as well. And it's done in a non-judgmental way. And I just want to put that out there because I think there's a lot of stigma around having diabetes or health issues related to diabetes. And the program is designed to empower people and to lean on the resources they have and the strengths they have. Another program I'm certified in is Generation RX. That is a prescription drug abuse prevention program. And I can do that for all ages. They've got different programs for different ages. So if I'm teaching to preschoolers at Head Start, we're doing, is this medicine or is it candy? And if you see candy on the ground, what should you do? And look, I got a 10 and 13-year-old, and occasionally they pick stuff up off the ground and try to put it in their mouth. And I'm like, guys, like we've been doing this since preschool. But it's a good lesson. And then for adults, we talk a lot more about medication storage, medication disposal, making sure we're taking our medications as prescribed, not drinking alcohol, not sharing medications, those kind of things. That has been a really valuable program. I've gotten a lot of good feedback, especially from adults. And I'm sorry about the squeaking in the background. There is a dog. So if you hear that, just ignore him. So yeah, another program I do is Catch My Breath. It's youth anti-vaping. There's also a cannabis component to Catch My Breath. If you've got folks that are 5th through 12th grade, probably not in the reentry community, but that's one we do. That's also the one that the state has determined is important for the schools to implement. I'm also Impact Melanoma. Your Skin is in train, so we can do training with folks about wearing sunscreen and looking out for signs of skin cancer and protecting our skin. And then I just got a vaccine certificate. That's always a tricky subject with folks. But for those that are interested in learning more about vaccines or have questions about vaccines, I have that certification as well to talk about what the process is and help demystify some of that. One thing that if you notice on the map right now, measles is in every state surrounding West Virginia, but not West Virginia. And the reason is because we have extremely high vaccination rates for school age kids for measles. And so it's created a great protection for the state. And so it's important to help folks understand, why that is and how that works if they have questions. Yeah, so that's largely some of the health education I do. I'll stop now. Does anyone have any questions about that stuff specifically? And I can talk briefly about benefits. And I cannot see the chat. So Jonathan, if there's any questions in the chat, would you mind taking a peek for me?
No, there's no questions in the chat. Ms. Brown, you have anything? Okay, I don't
Rachel,
know huh?
I was Rachel, I have a question. So I worked with you before, but I was with the youth program. So now I'm working with people at the residential reentry centers,
Mhm.
and that's where I'm at today, actually. So one thing I've noticed, I was given a caseload of 0, so I'm just, starting from the bottom. But none of the people here receive Medicaid, SNAP, that kind of thing. So I'm assuming that they don't qualify until they're out of here. Do you know about? Because
That's probably a HHR question. I don't know anything about sign up for that. We've had folks through our employment program that are like on their way out of incarceration. So I'm not exactly sure how that all works, but that is one barrier. They get out and they don't have any health care. And so it's important to start establishing those things 6 months before we get out so that they have what they need.
yeah. Well, several of the people that I've met so far, and like I said, I'm just getting into the center, are releasing the Parkersburg. And so, I'm trying to, and that's part of my job is helping them be prepared for the release. So I will see if DOHS, I will check with them and see what I can find out.
Yeah, I don't know anything about that end. Like I said, we're so on the other end, we are getting referrals from members who are already in. And same thing with the benefits. If there's any questions, the number on the back of the card, those folks know they're able to answer a lot more of those more detailed questions about benefits. But I'll go over some of them because this might be important for those who are in reentry and wanting to get established with care right away. So some of the benefits, and all Medicaid plans offer benefits. So these are just ours. Folks can look on the websites, compare and contrast for what ones worked for them. We have a 24-hour nurse line. We have special disease management programs, both for asthma and diabetes. A possibility to get a cell phone, because obviously it's really hard to schedule and make appointments without a cell phone. We have $170 in baby essentials gift card items. So that's for pregnant moms who complete their six prenatal visits. They're able to go and get whatever items they need for baby. It's a gift card. It's coded to baby items. So if they need a car seat or they need diapers or something like that, they're able to get what they need. We also have health and wellness items. So if you do your yearly wellness exam, you can get a voucher for personal hygiene products. You can go get shampoo, conditioner, soap, those kind of things. And it's, every little bit helps, right? If someone's trying to get on their feet, let's get them to their well visits. Let's see if we can't get them what they need. We also have feminine care kits for girls age 10 to 18. We have emotional well-being program for those age 13 and up. If someone has diabetes, hypertension, obesity, they can get up to $75 in aid. So if they need to get a blood pressure cuff or a new glucose monitor or something like that, they're able to get those aids for free to them through the program. There is a substance use disorder recovery program. We can refer to the helpline for smoking, free Weight Watcher memberships. We offer Boys and Girls Club memberships for kids. So if someone's getting out, they want to get in the workforce and they need childcare after school, we can do Boys and Girls Club memberships. That is school year only. It doesn't cover summer camp. But Wood County has a really big, phenomenal Boys and Girls Club program. My kids go there. We also have an Active and Fit program. So if there's a Planet Fitness near them, they could go get a membership at the gym. If they don't have a gym near them, we have items that we can send to them. They can go online and pick, do I want one of those yoga balls, or do I want a swim kit or something? So they can, if they have a certain way they like to work out at home, we can give them some aids every year for that. If they do their dental visit, they'll get a little dental care kit with a toothbrush. We also offer $25 in gas cards every quarter for members. So that's a little bit of extra help to get them wherever they need to go, a job interview, doctor's visit, what have you, grocery store. There's our employment support package. And then in some counties, you can get filtered water pitchers. If they're counties with high lead, you'd have to call and see if they qualify. I don't think any in this area are on that list. But if they have kids ages 0 to 2 and they do their lead screening, they can get a filtered water pitcher to help make sure we're keeping the lead numbers down. And those are all free to members. All they got to do is call the number on the back of their card or go onto the website in their member portal and just say, hey, I want my benefits. Those are what they have. We also have a Healthy Rewards program, and that's incentives for going to the doctor's visits, getting your exams. Again, you just call and say, hey, I want to sign up for Healthy Rewards. The trick with Healthy Rewards, as we found, is you have to call before you go to the doctor's appointment. And then doctors have 90 days to bill. And so if they take the full 90 days, it may be 3 months before it gets pinged to us, and then we're able to offer the gift card. But the members get an email that says you can go pick a gift card for making this appointment, and they can go online, and it's like a lot of different choices. Near Christmas time, I tell them, go get your pap smears, go get your mammograms, go get your prenatal checkups, and then you can earn gift cards to GameStops for your older kids, right? But it's also to help make sure that we're meeting those wellness and preventative exams. Preventative care is far less expensive than waiting till stuff hits the fan. And now we've got advanced stage cervical cancer, or we've got a kid who hasn't been doing well on their ADHD meds or things like that. So I'll just go through it really quick. They can get $10 just for completing a health screener. So it's just a little survey about their health. Prenatal checkups, their first one, they get $25. Once they complete 6, they get another $25. Once they go postpartum, they get another $25. Well child visits are $25. Adolescent visits are $25. We really want to see these kids getting in periodically. For the adults, you're looking at over the age of 40, you can get $10 for your flu shot. If you're doing your A1C screening, if you're on antipsychotics, it's $25. Your cervical cancer, breast cancer, diabetic A1C screenings are all $50 gift cards. So, it's not great if you have diabetes, but if you're going and getting your diabetes work done, you're getting some gift cards for it. If you do a diabetes management quiz, it's a $5 gift card. The retinal eye exam is $50. If your kid age 0 to 2 gets a lead screening, it's $25. Plus you can get that filtered water pitcher. And if you're age 2 and older and you go for your dental visit, that's a $25 gift card. And you can get the little toothbrush kit. So lots of little incentives for members. When agencies are working with members and they're a little short on cash, or they need a little extra money for groceries, I refer them to those programs to say, hey, that's an easy gift card you can earn. Just sign up for the program. If you're going to your well visits, those are things you can do. And I don't know much beyond that for the benefits. I'm literally reading off the flyers that we pass out. But if you have further questions, the number on the back of the member's card is going to help them with that. Any questions there? So that's all I have. If you guys have questions, or you want more information, or you work with a group of folks and you think, wow, I really wish they would learn more about this health topic, I can come in and do it Nicole has seen my programming, so she can speak to if I'm boring or not. But I think most of the time I try to keep groups engaged. I try to keep it interactive. I'm an anti-PowerPoint person, mostly because technology and I aren't friends, but also because I have the attention span of a gnat, and so I know what it's like to learn that way. But yeah, that's a little bit about our program, about what population health does, and what the health promotion work is. And we're really trying to do is help build up our members, help give them the resources and tools they need to manage their health. And as you all know, health plays into so many different factors. If we are dealing with a complex health condition, it can make recovery more difficult. If we don't have resources for food or other things, it's really hard to focus on applying for jobs or getting back on our feet or making NA meetings or things like that. So any place that we can help, it helps the health of the state, it helps our members. And one thing I love about working on the team I do is that we're all local and we all love what we do and we love the people we work with. And I think that makes a huge difference for healthcare all around, and for getting folks back on their feet, is to know that it's somebody that really genuinely understands the difficulties we face trying to get back where we need to go. So that's it. That's all I got.
Anybody have any questions there in the workforce MOV? Do you guys have anything?
I don't have any questions, but I think this was really wonderful, and I had not heard about this program. We work at Legal Aid of West Virginia, so this is really neat to get to see a public health kind of standpoint that we could discuss with our clients if we're noticing some patterns and some concerns about their health. So thank you.
You're welcome. Happy to partner anytime if you want to do I know you guys are doing client advocacy. Some of the legal aids are doing client advocacy. And I was just sitting there thinking when Tammy was talking about it yesterday, I was like, oh my gosh, this is part of our diabetes program where we talk about the rights you have with the doctor and responsibility. Yeah. So it's great.
Tammy Ketchum, I assume, has your contact information?
She does.
I'm going to connect with her today then. An event came to mind that we're doing with the public defenders here in Wood County in October. And it's a lot of health-based substance use disorder kind of programming, but it might be really neat if you haven't received an invitation yet. It's still very much in the works, but I'd love to kind of keep you in the loop for it and see if you might be interested in attending an event like that. So thank you.
Yeah.
Brown, you have anything? She must not be. She must be doing something else today. Aaliyah, you have any questions or anything?
No, I'm glad that Rachel was on today because while you were talking, Rachel, I think I have a client I'm going to give your information to and send them your direction.
I don't. So in order to get a client on our caseload, they have to call the number on the back of their card. If they're wanting help with social determinants, they can ask for case management or navigator. If it's just like food, transportation, housing, that kind of stuff, that's navigator. If they've got a complex health condition, then they would, that's on top of those issues, that would be case management. But if they call the number on the back of the card, that's how they'll get in the system through me. I can't work directly with anyone until I get, you know how this works, right?
Oh yeah. Oh yeah.
Rachel, hey Rachel, do you have a number that I can put in the chat with your stuff that maybe they can call?
Yes. So the number for members is 888-990-8681. And if you all want to get a hold of me, that's a different number. I do best with texting or email. And my work phone number is 304-514-3496.
Okay. That's your work phone?
Yeah, that's my work phone.
Okay.
And definitely texting or email. I'm out of service when I drive a lot, so I don't always get notifications of calls and voicemails. But text actually come through.
Now, what was that 888 number that you gave me?
So that's the customer service line.
Okay, all right.
That's the Healthy Rewards customer service line. Let me give you the general customer service line. So if they're a member and they want general customer service and they're not looking for the Healthy Rewards gift cards, that number is 800-782.
I'll say 800
Mm-hmm.
782.
0095. And fun fact, if you call that number, you can get benefits and Healthy Rewards through that number. So I don't know why there's a different number. I'm one-stop shop.
So the Healthy Rewards was the 888, and then this one's just customer service.
Yep. And so
Okay.
that so they can call for benefits if they want case management. We also have behavioral health management. So if somebody has been discharged from, say, inpatient care for behavioral health, they can have follow-up with that. And then also they can ask for a navigator if they're just having issues with social determinant needs. I need housing, I need transportation. I'm having trouble getting access to clean water. I don't have a stove. Those kind of things are what our navigators would do.
Okay.
Sorry for the confusion. I was looking at the wrong flyer.
Well, you're fine. Okay, so customer service, Healthy Rewards line, and then just regular customer service. And then I have your work phone, and then I have all your information here.
Mhm.
All right. All right, guys, I put everything in the chat if you need anything. Ms. Dugan, do you have anything?
I guess I kind of do. I wasn't going to ask because it's kind of a huge question and maybe I should already know the answer, but so I mean, these programs that the insurances are providing, all these extra services are fantastic. So can you tell me kind of where they originated from, I mean, I know they've been around for a while, but I guess I never really had the backstory of why these were developed, and did they change the insurance in any way, or the provision of services, or you know, however you want to
I'm not to answer that specifically. Each Medicaid managed care organization has a contract with the state. And so they negotiate that contract with the state. The state says, these are our health priorities. How are we going to achieve those health priorities? And then we all have metrics we have to meet with the state. One of the things that is really important for any insurance company is to make sure preventative care visits are happening. So whatever insurance you have, they're always going to offer some benefits saying like, oh, go get your health checkup, do your health screening. And part of that is to help ensure that costs stay low, but also, you know, caring about members, wanting to make sure folks are doing the best they can with what they've got. I do know as a whole, healthcare has moved in a more public health, more social determinants related direction, because they've realized that so much of healthcare has to do with all of these other pieces. And so if we just call somebody and say, go get your mammogram, well, that's great. But if they can't get to the doctor's office to get their mammogram, it does no help to say, well, you just need this care. And so generally as a whole, health insurance has started saying we need to start bolstering these areas. If we get somebody a gas card, they're more likely to make their appointments. And it still costs less than when they're missing appointments, especially when we start getting into those specialized situations where we've got kids on ADHD meds and they need to be checking in every 3 months to make sure that things are going well with them. Or like folks with diabetes, they really need to be getting those routine blood screenings because so much damage can happen in organs if we don't have that number under control. So I would say I can talk on a general level. I can't talk about specifics, but I can connect you to somebody who can if you're really curious about how that process works. It's above my pay grade is the short answer. But I do know that it has been a national thing. You'll see a trend right now is for community health workers. It's not something that is recognized in the state of West Virginia, but in Ohio, the state nursing board is licensing community health workers. And they're folks that literally come in and do this bridging of the gap between healthcare and all these other things that are affecting health and helping folks get what they need, because it's not easy. Nobody, when you turn 18, nobody gave me a book that said, here's the appointments you're supposed to schedule. Here's how you call and get your prescription refilled. Here's how you know. I mean, nobody gave that to me, and we all just kind of stumbled into it. And, for folks that don't have a lot of resources, they are just lost. And understandably so. Like, you can't just say you've got diabetes and set somebody out in the into the wild and expect them to know what to do. So that I know has been a really big push for all of us. But if you'd like more details about that, I could totally find you somebody that has answers.
I think you did a fine job explaining that. So yeah, I heard what you said, and it is very valuable, and you're right. So it's kind of like a case management type where you're reminding people, you're providing resources, you're encouraging them to follow up or get what they need, the whole prevention and intervention piece and that sort of thing. So yeah, it makes great sense, and I appreciate your explanation. So thank you for that.
And the big thing is coordinating with all the community agencies, right? We can't offer everything, but if we can point someone in a direction where they're able to get help, I can't get someone a job, but there are wonderful one-stop centers everywhere. Or I've had a lot of folks say, oh, I need new hearing aids or I need glasses. I'm like, DRS can help you with that. If you're seeking work and this is the barrier to work, like let's get you hooked up. Or you need accommodations and you need someone to help advocate for your accommodations. Like, there's just a lot of things people don't know what a one-stop center does or what a DRS does. And that's where we can come in and fill that gap and say, hey, I'm speaking of employment specifically because that's on my mind today, but a lot of that explanation nobody gets, and nobody's reading the flyers. We have really great flyers, but either people can't read or, do I have time to read all the flyers I pick up at a resource fair? Sometimes. Sometimes not.
Hey,
Well,
Rachel,
thank you
this
so
is
much for addressing that.
Rachel. This is Rich, and Shannon. Shannon and I work for the same agency. I did shoot Rachel an email asking for more information about the employment program, Shannon. So I'll send that information when she gets that to me. And Rachel, I also noticed I'm looking at the agenda for tomorrow, and I noticed we're both on the agenda to present at Cedar Lakes tomorrow. So maybe I will see you there.
I've actually had to cancel for Cedar.
Oh no. Okay. Well, I won't see you there then.
You won't see me there, but you're still
Okay.
email me anytime. I saw there was an email that came through, so we are connected.
All right, great. Thank you.
Okay. Does anybody have anything else?
Hey guys, this is Taylor Darty with Aetna Better Health. First of all, just want to tell my colleague Rachel, excellent job as always. Even when we work for competing companies, it's always nice to know that we're all serving those in need in the state and doing our best promoting health and wellness. I just want to get on here, and I'm sorry I'm late. It's been kind of a whirlwind of electricity here in Morgantown. So I do outreach and education. So I do a little bit what Rachel does, but I'm also out and about in events and stuff like that. And I just want to give you guys a little, because you guys serve a lot of our population, and this is just my annoying PSA I'm going about sharing with folks. Obviously, there's a lot going on in our world and politics and the news, and this is not a political spiel, I promise. I work with a lot of people that are Medicaid eligible or they currently have Medicaid. And let's say, for example, in Morgantown this past Saturday, we had a community baby shower. I had 3 moms tell me, oh, I just got cut off on Medicaid. It must be the budget that the Senate approved already. Or they said the budget's been cut, or I lost because of the cut, or the budget cut. Basically, long story short, if and when that decision is made, it has not been made yet. And so we're having to remind our members they got to reapply every year. And so that's a spiel we have to remind our folks all the time. You know, that is something you got to keep an eye on your mail. You got to make sure your contact information is up to date. But because of this conversation that is happening in our media and passing by, it's confusing a lot of our members, thinking that, oh, that must be why I lost my Medicaid. It's because of this budget cut. So I'm just reminding folks, again, I know the wire's on regarding if and when this vote happens, but just to remind your folks that they still have to reapply if and when that cut does happen. So that's just greatly important. And it's also an opportunity to make sure that their contact information is up to date with either DHS, their Medicaid provider. That is just huge. And so it just breaks my heart, this constant conversation can easily confuse folks. And so we just got to remind them they probably still have Medicaid. They just need to reapply every year, along with their family members that have the coverage too. So that's just my PSA today. It's just an unfortunate thing I'm seeing a high trend on lately.
Thank you.
And a lot of folks don't know that they are on Medicaid. They'll say I'm on Aetna or I'm on WellPoint or whatever, and they don't realize that this is the Medicaid that they are talking about on a federal level. So just some education.
Correct,
Yeah, for education, help and remind them of the importance of these programs and the value of these programs, especially for our state, is really, really important. And I think we all agree, all of us agree that our jobs are very important and what we do is very important and helpful to the state. So I feel like I'm preaching to the choir in this digital room.
Can I have your attention, please?
Was that somebody asking the question or was that?
Sound like a hacker, didn't it? I heard some there for a while. People were able to hack into your meetings, and I just heard somebody say, "Can I have your attention, please?" So that was weird.
All righty, ladies and gentlemen, if nobody has anything else, I will give you back 14 minutes of your day. And oh, hold on, somebody. Okay, yeah, Taylor. So thank you guys. Have a good day and be safe, be well, enjoy your weekend.
Can I have your attention, please?
Wow, that's strange.
Who is that?
I'm sorry, that was my cell phone. My daughter just texted me.
Oh, okay. It's like.
And I have McGonagall from Harry Potter when she walks into the class and she goes, "Can I have your attention, please?"
That's hilarious.
Because it's loud and I can hear it in my house and when my phone is in the kitchen and I'm in the living room and I forgot to put it on silent. I am so sorry.
It's fine. I just like, I thought I was hearing stuff there for a minute.
Glad we don't have a hacker.
Nope, that was my phone. My daughter was texting me to tell me that she was out of her doctor's appointment.
All right.
Okay.
Everybody have a good weekend.
You too.
You too.